You know, as we get older, it's natural to rely on medications to help manage our health. But what if I told you that some of the very pills we take to feel better might actually be doing more harm than good? It's a scary thought, isn't it? And the truth is, many seniors are prescribed medications that can cause serious side effects, especially after 60. Now, I'm not saying you should stop taking your prescriptions. Never do that without talking to your doctor first. But what I am saying is that it's important to ask the right questions, because sometimes there's safer alternatives that can work just as well, or even better, for your body at this stage of life. So today, we're going to talk about 4 common medications that can be risky for seniors and what you can discuss with your doctor instead. My hope is that this information helps you feel more confident in those conversations so you can make the best choices for your health. Now, let's start with the first one, a medication you might be taking right now without realizing its potential risks. 1. Sleeping pills, like Ambien or Lunesta. If you've ever struggled with sleepless nights, you're not alone. So many of us find that as we age, falling and staying asleep becomes harder, and it's tempting to reach for a sleeping pill, especially when your doctor prescribes one. But here's the problem. Many of these medications, like Ambien or Lunesta, can have serious side effects for seniors. For one, they can make you feel drowsy or dizzy the next day, which increases the risk of falls. And falls are no joke. They're a leading cause of injury for older adults. Plus, these medications can sometimes cause confusion or even memory problems, which can be especially concerning if you're already dealing with a bit of forgetfulness. So, what can you ask your doctor instead? Well, first, it's worth looking into why you're having trouble sleeping. Is it stress, pain, frequent trips to the bathroom? Once you pinpoint the cause, there might be safer solutions. For example, melatonin, a natural hormone that helps regulate sleep, can be a gentler option for some people. Or your doctor might recommend cognitive behavioral therapy for insomnia, CBTI, which has been shown to work just as well as medication without the side effects. The key here is to have that conversation. You might say, "I've been having trouble sleeping, but I'm concerned about the side effects of sleeping pills. Are there any non-drug options we could try first?" 2. NSAIDs like ibuprofen or naproxen. Now, let's talk about pain relievers, specifically NSAIDs like ibuprofen, Advil, or naproxen Aleve. These are go-to medications for aches and pains, right? A sore knee, a stiff back. Pop a couple of these, and you're good to go. But for seniors, these over-the-counter pills can come with hidden dangers. The biggest issue, they can irritate your stomach lining, leading to ulcers or even bleeding, especially if you take them regularly. And if you're on blood thinners or have kidney problems, the risks are even higher. So what's the alternative? Well, for occasional pain, acetaminophen, Tylenol, is often safer for the stomach, though you still want to be careful with the dosage. But for chronic pain, it's worth exploring other options. Physical therapy, for example, can work wonders for joint pain. Or, if it's inflammation causing your discomfort, your doctor might suggest dietary changes, like adding more anti-inflammatory foods. Think fish, nuts, and olive oil. The next time you reach for that bottle of ibuprofen, consider asking your doctor. "I've been using NSAIDs for pain, but I'm worried about the long-term effects. Are there other treatments we could explore?" Now, these first 2 medications are just the beginning. There are a couple more that we need to talk about, ones that might surprise you. So, let's keep going and look at the next common medication that could be affecting your health in ways you don't expect. We've already talked about how sleeping pills and NSAIDs can sometimes do more harm than good as we get older. But there are 2 more medications that many seniors take without realizing the risks. Medications that might be quietly affecting your energy, your balance, or even your memory. Now, I know it can feel overwhelming to hear that some of the pills you've been relying on might not be the best fit for you anymore. But remember, knowledge is power. The more you know, the better you can work with your doctor to find solutions that keep you feeling your best. So, let's dive into the next medication on our list, one that's often prescribed for anxiety or nerve pain, but can have some surprising effects after 60. 3. Benzodiazepines, like Valium or Xanax. If you've ever been prescribed something like Valium, Xanax, or Ativan for anxiety, insomnia, or even muscle spasms. You're not alone. These medications, called benzodiazepines, are some of the most commonly prescribed drugs in the world. But here's the thing. For seniors, they can be riskier than many people realize. Why? Well, as we age, our bodies process medications differently. Benzodiazepines stay in your system longer, which means they can build up over time. This can lead to excessive drowsiness, confusion, and even memory problems. And just like with sleeping pills, they can increase your risk of falls, something we definitely want to avoid. But what's really concerning is that long-term use of these medications has been linked to a higher risk of dementia. Now, that doesn't mean everyone who takes them will develop memory issues, but it's enough of a concern that experts recommend avoiding them for seniors whenever possible. So what can you do instead? If you've been taking a benzodiazepine for anxiety, ask your doctor about alternatives like therapy or relaxation techniques. For nerve pain, medications like gabapentin might be a safer option, though, of course, that's something to discuss with your healthcare provider. A good way to start that conversation: try saying something like, "I've been taking this medication for a while, but I've heard there might be risks for seniors. Are there other treatments we could consider?" 4. Proton pump inhibitors, like Nexium or Prilosec. Now, let's talk about a medication you might be taking for heartburn or acid reflux. Drugs like Nexium, Prilosec, or Prevacid. These are called proton pump inhibitors, or PPIs, and millions of people use them to manage stomach acid. But here's the catch. If you've been on them for a long time, they can cause some serious problems. First, they can interfere with your body's ability to absorb important nutrients like calcium and magnesium. Over time, that can lead to weaker bones, and we all know how crucial bone strength is as we get older. PPIs have also been linked to a higher risk of infections, including pneumonia and even certain gut infections. Now, I'm not saying you should stop taking them cold turkey, especially if you have a condition like GERD, but many people take PPIs longer than they really need to. So what's the alternative? For occasional heartburn, antacids like Tums or Rolaids can help. For more frequent issues, your doctor might suggest H2 blockers, like Pepcid, which are generally safer for long-term use. And lifestyle changes, like eating smaller meals, avoiding trigger foods, or not lying down right after eating, can make a big difference too. So, the next time you refill that PPI prescription, consider asking your doctor, "I've been on this medication for a while. Is it still necessary? Or are there gentler options we could try?" Now, we've covered 4 common medications that can be risky for seniors: sleeping pills, NSAIDs, benzodiazepines, and PPIs. But here's the most important takeaway. You don't have to navigate this alone. Your doctor is your partner in health, and having these conversations can help you find the safest, most effective treatments for your body. In the next part, we'll talk about how to approach these discussions with confidence, plus some general tips for managing medications as you age. Because at the end of the day, the goal isn't to scare you. It's to empower you to take control of your health in the best way possible. You know, when it comes to our health, especially as we get a little older, it's easy to assume that if a doctor prescribes something, it must be safe. And most of the time, that's true. But our bodies change with age, and sometimes, medications that worked well for us at 50 might not be the best choice at 70 or 80. Over the past 2 parts of this discussion, we've talked about 4 common medications: sleeping pills, NSAIDs, benzodiazepines, and PPIs, that can sometimes cause more harm than good for seniors. But here's the good news. Just being aware of these risks puts you ahead of the game. Now, you can walk into your next doctor's appointment with the right questions and the confidence to advocate for your health. So, let's wrap this up with some final thoughts on how to make sure your medications are working for you, not against you. How to talk to your doctor about your medications. First, let's tackle something that holds a lot of us back: the fear of questioning our doctors. I get it, doctors are experts, and it can feel intimidating to bring up concerns. But remember, you are the most important part of your healthcare team. A good doctor will want you to ask questions and will take the time to explain your options. Here's a simple way to start the conversation. I've been reading about how some medications can affect seniors differently. Could we review my prescriptions to make sure they're still the best fit for me? Are there any medications I'm taking that might be risky at my age? Are there safer alternatives? You might even ask for a medication review, where your doctor or pharmacist goes through all your prescriptions, over-the-counter pills, and supplements to check for interactions or unnecessary risks. This is especially important if you see multiple doctors, since one might not always know what the other has prescribed. A few general rules for medication safety after 60. Less is often more. The more medications you take, the higher the chance of side effects or interactions. Ask your doctor if any of your pills could be reduced or stopped. Start low, go slow. Seniors often need lower doses than younger adults. If you're prescribed something new, ask, is this the lowest effective dose for someone my age? Keep a list. Write down every medication you take, including vitamins and herbals, and bring it to every appointment. Your pharmacist can help with this too. Watch for warning signs. If you notice new dizziness, confusion, or fatigue after starting a medication, don't brush it off. Tell your doctor right away. Final thought, you're in control. Here's the truth. Aging doesn't have to mean accepting a laundry list of pills and their side effects. Sometimes small tweaks, like switching to a safer alternative or adjusting a dose, can make a world of difference in how you feel every day. So, take this information as your starting point. Review your medications, jot down your questions, and remember, you deserve to feel your best at any age. And hey, if you've had an experience where changing a medication made a big difference for you, I'd love to hear about it in the comments below. Your story might help someone else. If you found this video helpful, don't forget to hit that like button and subscribe for more tips on living well after 60. Because when it comes to your health, you're never too old to make a positive change. Here's to taking charge and thriving today and every day ahead. Thanks for watching, and I'll see you in the next video.